Hey guys, my name is Amanpreet Singh and welcome back to Dental Secrets. A lot of my friends have been sending me pictures of their x-rays or pictures of their teeth or conversations they've had with their dentist recommending certain treatments. And they've basically been asking me if they recommend this treatment or if they think that the dentist is being too aggressive or if they can really trust their dentist. And this kind of goes with the stigma of being a dentist, right? You know, they're really money hungry, they cause a lot of pain, and it makes a lot of sense why patients are anxious to go to them in the first place. That being said, the importance of going to the dentist is definitely there. And we've seen it with COVID these last couple of years, where I've seen a lot of patients that have come in for the first time in 2 years, and 2 years ago their teeth were fine, and now they have a bunch of cavities everywhere, or they have severe gum disease starting to form, and they didn't have that 2 years ago. And now these patients are wondering what happened in those last 2 years. And it doesn't seem like a very long period of time. I wouldn't have thought that 2 years for most people would have caused that much of a difference, but I've been seeing a lot of people get negatively affected by it. Now, not only is it important to go to the dentist, it's important to trust your dentist and make sure you're going to the right person. Just like any field or any profession, you're always going to have some people that are more shady and some people that are more trustworthy. And I'm going to give you guys 5 tips on how to find the right dentist and how to find someone that you can actually trust. But before I get started with the video, make sure you hit that thumbs up button and subscribe to our channel below. So if I was looking for a new dentist, knowing the knowledge that I know now, I would approach it just like I approach a restaurant. I would look at all the Google reviews and I would see how people actually rate the practice. And if I see a practice that has a lot of new Google reviews and you see a lot of new patients that are commenting and actually showing how happy they are going to that dentist, I would be more inclined to pick that dentist over someone that doesn't have that. Now you have to look at this with a grain of salt because dentists know that patients are looking for the Google reviews. So a lot of dentist offices perform their marketing by catering to patients that will leave a 5-star review. For example, they'll be like, oh, leave us a 5-star review and we'll enter you into a raffle to win some baseball tickets. So it's not necessarily cheating, but it's definitely inflating their 5-star reviews. Now that being said, if you read these Google reviews, sometimes patients will comment or leave paragraphs about how their experience was. And here you can see if patients are actually enjoying going there or just leaving a 5-star review just because. Now if you're looking for a new dentist, whether you just moved somewhere or if you just don't like your old dentist, you want someone that will talk to you and treat you like a human. And I talked about this in some of my earlier videos. You don't want to go to a dentist that treats you like an object with a set of teeth. You want to go to a dentist that actually treats you like a human and understands your needs and understands why you're there in the first place. So the second tip I'd have in choosing the right dentist is looking at how quick your exams are done. Now typically what happens when you go to a new dentist is you get some x-rays done, you get a cleaning done, and you get an exam done. This isn't always true. Sometimes certain patients have needs that are more important than getting a cleaning right away, so the dentist will address those first, but this is generally true for most patients. Now, when you're getting your exam done by the dentist, you want to see how that dentist treats you. Sometimes when you go in for your cleaning, the dentist will do a really quick exam and send you home. And that's not necessarily bad. Sometimes you just have no needs and you can just go home without spending any more money, right? But if you're a new patient, you would want your dentist to spend a little more time with you. If I was going to the dentist for the first time, I would want them to sit down with me and establish any goals that I have, any concerns that I have with my mouth, and then go on with the exam from there. I've seen too many dentists just go straight into the room, look at all the x-rays and say everything they found that was wrong, come up with a quick treatment plan in about 2 to 5 minutes and just walk out. This is not establishing a good rapport with the patients. Now that dentist may not be wrong, you might actually need those 5 fillings, but if they don't take the time to explain it to you and actually treat you like a human, I would probably go shopping around elsewhere. Now I will say this is more common in corporate offices versus private practices. The reason is these corporate offices tend to push a lot more treatment, and the dentists here are typically a lot busier than in a private practice. So there's just not as much time to sit down one-on-one with each patient and go over everything that they would like to. Now the next tip I have, or something to look out for, is the dentist planning a lot of aggressive treatment? And again, this is more common in those corporate offices, but it can really happen anywhere. If you're going to a new dentist for the first time and they're planning a lot of treatment and something in your gut is telling you that it's off, I would recommend getting a second opinion. It's not a bad idea to get a second opinion in dentistry, but when you do, you should know that you're probably going to hear slightly different treatment plans. And the reason is dentistry is very subjective. It's not uncommon for one dentist to recommend one treatment plan and a different dentist to recommend something different. For example, one dentist might say you need a few fillings, and another dentist might say you can actually wait a little bit and we'll see how it changes. Now, if you hear some differences like that, I wouldn't say it's a big deal because it really depends on the philosophy that the dentist is practicing. Sometimes dentists are a little more aggressive, and sometimes dentists are a little more passive in their treatment options. Neither one is necessarily right or wrong, and you may be wondering, why not just go with the passive route? Well, sometimes it's actually better to be more aggressive. I've seen teeth where I would recommend a crown because I see some cracks or a fracture in the tooth, and other people may recommend just watching it and observing it over time. While that tooth may be fine over time, that tooth may also break. And depending on how that tooth breaks, it may not even be restorable anymore, or it may require a root canal before fixing it. Now, in a case like that, being a little more aggressive in the beginning will prevent you from being even more aggressive in the future. So I'm going to say this again, it's normal to have slightly different treatment plans from the dentist. But if you have something that's completely different, that's when I would draw a red flag. If you have one dentist that's saying you need a filling on every single tooth, or you need a crown on every single tooth, and you go to a second dentist and they're saying your teeth are actually fine, you only need 1 or 2 fillings, I would probably trust that second dentist over the first dentist. And again, you're more likely to see aggressive treatment plans like that in a corporate office. And the reason is these corporate offices really push production. They really want dentists to produce, they really want their hygienists to produce, and sometimes the culture of these offices really pushes unnecessary treatment. Now, going off of that, the fourth tip I would give you is, can the dentist take intraoral photos to actually show you what's going on? Right now, with technology being so advanced, there is absolutely no reason a dentist should not be able to take a picture of your tooth and show you what's going on. And I'm not talking about an X-ray, I'm talking about actually taking a picture of your tooth and showing you what your tooth looks like. Now, there are some cavities that you can only see on an X-ray, and taking an actual picture of the tooth won't really do any justice. But that being said, a dentist should be able to take a picture of your tooth and show you what's going on. Most of the time when I recommend a crown or I recommend a filling on the biting surface of a tooth, I always show a picture to the patient so they can actually see it for themselves. If you ask your dentist to actually show you what's going on and they can't explain it to you with an X-ray, or they can't actually show you a picture, I would totally run away. And I know technology is expensive, and I'm not saying your dentist should have the most up-to-date technology. While it would be cool to go to a dentist that has all the coolest, newest technology, that's really not necessary to get the best treatment and to actually trust your dentist. But just having a camera that can take a picture of your tooth is pretty cheap. And I would say, especially nowadays, that is the bare minimum you should have when presenting treatment to a patient. Now, the last tip I have is to see how the staff is actually treating you. And I know this may not entirely be on the dentist, but having a staff that can actually treat you well will actually be a good indicator to how your treatment will be by the dentist. If a team actually treats you well, that means that they're probably happy with the work that the dentist does. And how would you react? Would you rather walk into an office where the staff is smiling and they greet you and they actually make you feel welcome, like you're part of their family? Or would you rather walk into a building where the staff feels cold, they're not smiling at you, and they're barely even having a conversation with you? Now, I know this is generalizing as to how good the dentist actually is, but most of the time the dentist is a leader in an office, and they are the reason the staff is acting that way in the first place. So if a dentist treats a staff well and they train the staff to treat the patients well, they're probably going to treat you well in return. Now, this isn't always the case. Sometimes the dentist doesn't really have as much of a say. And again, I'm going to go back to being in a corporate office. I used to work in a corporate office, and I was not happy with how the staff treated the patients. And I brought this up to multiple people. I brought this up to the managers, I brought this up to the higher up people, and nothing changed. It got to the point where I just got so fed up and I quit. Thank you guys for watching. I hope you liked that video. If you have any questions or anything else you want me to talk about, please let me know in the comment section below. And as always, if you haven't already, please hit that thumbs up button and subscribe to our channel so you don't miss our new videos.